Welcome to the module on Introduction to CPT Coding. In this lesson, we will dive into one of the most important code sets used in medical coding, the current procedural terminology, or CPT. CPT codes serve as the universal language for reporting medical procedures and services across healthcare. Whether you're coding for outpatient coders, physician services, office visits, or surgical procedures, CPT is the primary code set used to describe what services were provided during patient care. In this lesson, we will walk through the structure of the CPT codebook, how it's organized, and the tools and guidelines that you'll need to navigate it accurately. We'll cover Category 1, 2, and 3 codes, symbols and conventions, modifiers, and the appendices that provide essential references for correct coding. Mastering CPT is critical not only for accurate coding, but also for proper reimbursement, compliance, and quality reporting. This foundational knowledge will serve you throughout your coding career, whether you're preparing for a certification or actively coding in practice. Let's get started. The current Procedural Terminology, or CPT codebook, is a comprehensive collection of guidelines, codes, and descriptions used to report healthcare services that are provided by providers in the United States. Maintained and copyrighted by the American Medical Association, or AMA, the CPT code set works in conjunction with other federally mandated code sets that are established by the Department of Health and Human Services and related agencies for standardized healthcare reporting and reimbursement. Originally published in 1966 by the AMA, the CPT code set was created to serve as a uniform coding system, promoting consistent terminology among physicians and healthcare providers. In 1983, the Healthcare Financing Administration, HCFA, now known as the Centers for Medicare and Medicaid Services, CMS, adopted CPT codes alongside your HCPCS Level 2, making these coding systems mandatory for all Medicare billing. This marks a significant step towards nationwide standardization for reporting medical services, procedures, equipment, and supplies. Following Medicare's lead, both Medicaid programs and commercial insurance plans quickly incorporated CPT and HCPCS Level 2 codes into their billing requirements. Today, these code sets are universally used across the United States healthcare system in order to ensure accurate reporting, efficient processing, and consistent reimbursement for healthcare services. Now that we've covered some of the history behind CPT, let's move on and talk about the format of your CPT codebook. Much of the information that we will go over comes directly from the introduction section of the CPT book. While I won't cover every detail in this session, I do want to highlight a few key points. That said, please make sure to thoroughly review the introduction on your own time. It is a section that's often overlooked, but it does contain valuable information that you'll want to be familiar with as a coder. Now, let's go ahead and turn to the introduction section in your CPT codebook. You can pause here if you need to. Under instructions for use of the CPT codebook, there are several important reminders. In the second sentence, CPT makes it very clear that you should not select a CPT code that merely approximates the service that is provided. Instead, if no code accurately describes the service that is performed, you should select an unlisted procedure code. This helps ensure that we are coding precisely and not guessing or stretching codes to fit a service. Next, in the 5th paragraph, you'll see guidance on the importance of reading the parenthetical instructions that are listed throughout the codebook. These parentheticals are there to help prevent any significant coding errors. However, keep this in mind. While they are helpful, they are not all-inclusive. You will still need to refer to other coding resources when necessary. That same paragraph also emphasizes the need for accuracy and quality in coding. It recommends using multiple resources to ensure your correct coding assignment, such as your CPT guidelines themselves, the AMA CPT Assistant, as well as other official coding references. The CPT code set includes 3 categories of medical nomenclature and descriptors: your Category 1, Category 2, and Category 3. All 3 of these categories are contained within the CPT codebook. Now, let's take a closer look at your Category 1 CPT codes, since these will make up the majority of the codes that you will use as a medical coder. Category 1 codes use a 5-digit numerical format. For example, 99234. These codes represent the most commonly used procedures, services, and professional services that are provided by physicians and other qualified healthcare professionals. Currently, there are over 7,000 individual service codes within your Category 1 section, and each code is accompanied by a description, title, and often applicable modifiers to further clarify the service that is provided. The American Medical Association, or the AMA, through a dedicated panel, reviews and updates these codes on an annual basis. This will help ensure that the code set stays current with the evolving medical practices, new technologies, and changes in healthcare delivery. Now, important to note here, it is mandatory to use a Category 1 CPT code for both reporting and reimbursement purposes. These codes will serve as the universal language between your healthcare providers, insurance companies, and government payers, making accurate code selection critical for your proper reimbursement and compliance. Now, let's talk about how the Category 1 CPT codes are organized within your CPT codebook. Category 1 codes are divided into 6 main sections. These sections are your evaluation and management, anesthesiology, surgery, radiology, path and lab, and medicine. Each of these sections will be grouped by the type of service or procedure that is provided, which helps make it easier to navigate the book more efficiently. While most of the sections are listed in a numerical order, there is one important exception. The evaluation and management, or the E&M section, is placed at the very beginning of the codebook, even though numerically it would be placed at the end. The reason for this is simple. Evaluation and management codes are the most commonly used codes in medical practice. Therefore, placing them first makes it easier for coders and providers to locate and reference these high-volume codes on a quick basis. As we continue to explore the format of the CPT codebook, let's take a closer look at how each main section is further broken down. Within each main section title, you'll find subsections that are divided based on different elements. Some subsections are divided by anatomic location, while others will be based on the type of procedure, the medical condition being treated, or the specific descriptor subheadings that further clarify the nature of the service. These subheadings will follow your CPT conventions and often include parenthetical instructions that may suggest alternate coding options. These parenthetical notes are extremely helpful because they serve as quick references, guiding you towards the most appropriate code for the specific service that is performed. It is important to always take the time to read these parentheticals because they can help you avoid coding errors and ensure the most accurate code selection. Now, let's pause for a quick exercise to practice locating these subsections in your CPT codebook. So pause this recording while you look for the subsection for debridement. Once you've located it, press play when you are ready to continue. You should now be looking at the debridement subsection, which is located on the first page after the integumentary system table of contents. In this example, you'll see how the CPT hierarchy works in action. This section is surgery. Subsection is your integumentary system. The subheading is skin, subcutaneous, and accessory structures. And finally, the category is debridement. When you look under debridement, you'll notice that there is a paragraph of guidelines providing important instructions on how to report these procedures. Following that paragraph, you'll see a list of alternate coding suggestions for related services. These alternate coding suggestions may include dermabrasions, nail debridement, burns, and pressure ulcers. These notes will serve as helpful reminders to verify whether the debridement you are coding might actually fall into a more specific category elsewhere within your CPT codebook. Taking a moment to review these alternate options can help ensure that you are reporting the most accurate and appropriate code for the service that is provided. Now that you've seen how the CPT codebook is organized into sections, subsections, and subheadings, it's important to understand that each section also includes specific guidelines that provide essential coding instructions. These section-specific guidelines appear at the beginning of each main section and serve a critical role in helping you apply the codes correctly. These guidelines clarify which codes can or cannot be reported together, when additional codes may be required, and they provide special instructions for certain services or procedures. In many cases, they also reference additional important information that you'll need to review to ensure that your code selection is both accurate and fully compliant. Let's take a moment to practice locating section-specific guidelines in your CPT codebook. One of the best examples can be found in the cardiovascular subsection. First, look for the section labeled for arteries and veins. Then locate the vascular injection procedures, which includes the code range 36000 to 36598. Take a moment now to locate the cardiovascular section in your CPT codebook. You can pause the recording while you locate it and then press play when you're ready to continue. Once you've reached the cardiovascular section and you've located the vascular injection procedures, you should see the section guidelines right after your cardiovascular table of contents. Under the cardiovascular system subheading, these guidelines provide specific instructions for coding procedures such as your catheterizations. The guidelines explain how to select the correct code based on the procedure that is performed. They outline what documentation is required to support your code selection, and they also clarify whether additional codes may be needed in order to fully describe the services that are provided during the encounter. As you can see, these section-specific guidelines are incredibly important, and they should always be reviewed when coding. They help prevent any errors, ensure completeness, and support accurate reporting for both clinical and reimbursement purposes. Now, let's shift our focus to the Category 2 CPT codes. These codes have a unique alphanumeric format, which means that they include both numbers and letters, with the letter F always appearing in the final position. For example, a typical Category 2 code would look like 0001F. You can locate the Category 2 codes near the back of your CPT codebook, positioned directly after your medicine section. These codes are designed to be reported in addition to your standard evaluation and management services or any clinical service within the CPT Category 1 that may apply to your patient encounter. Unlike Category 1 codes, which are mandatory for reporting and reimbursement, your Category 2 codes are completely optional. They were developed as performance measurement tracking codes to help facilitate the collection of data on the quality of care that is being delivered. Both the AMA and the CMS use this data to assess and monitor healthcare outcomes across different providers and care settings. These codes will play a significant role in your quality payment program, or QPP, which does include your MIPS quality reporting. Through this system, providers can report specific outcome measurements that are tied to certain medical conditions to demonstrate the quality of care that is provided to their patients. To help illustrate how Category 2 codes are used, Let's walk through an example. Imagine a physician counseling a patient regarding statin therapy for coronary artery disease. Statin therapy is prescribed to help the patient lower their LDL cholesterol levels, which is a key factor in managing coronary artery disease. In this case, the appropriate Category 2 code would be 4013F, indicating that this counseling service was provided during the visit. It's important to remember that you would still need to report the appropriate evaluation and management code for this visit alongside the Category 2 code, again, as your Category 2 codes are not standalone, but they are supplemental to your standard coding. There are a few important details to keep in mind when working with your Category 2 codes. First, Category 2 modifiers exist, but they are used exclusively with your Category 2 codes and will be listed in the Category 2 guidelines section of your code book. Second, because healthcare is always evolving, the AMA regularly adds Category 2 codes as additional quality measures are identified. The most current criteria can always be found on the AMA's official website. And lastly, for providers that are participating in Medicare's Quality Payment Program, CMS publishes the official Quality Measures Manual under the MIPS Quality Reporting section on its website, which is a key resource for ensuring compliance. So in summary, your Category 2 CPT codes will serve as valuable tools for tracking performance and quality of care. While they are not directly tied to your reimbursement, they are important for providers that are participating in your quality reporting programs. As we move on to the final category of CPT codes, let's talk about our Category 3 codes. You'll find the Category 3 CPT codes towards the back of your CPT code book, located directly after your Category 2 section. These codes will serve a very specific purpose and are different from both Category 1 and Category 2 codes. Category 3 codes are classified as your temporary codes. They are used primarily for data collection purposes, especially in connection with the FDA approval process. These codes allow the tracking of new and emerging technology, services, and procedures that are not widely used or fully approved for general practice. In many cases, Category 3 codes are assigned to procedures that are still under clinical study, evaluation, or awaiting broader acceptance within the medical community. Category 3 CPT codes will follow an alphanumeric structure, with the letter T appearing in the final position. For example, a Category 3 code might look like 0075T. Unlike Category 2 codes, which are always reported alongside a Category 1 service code, your Category 3 codes can be reported on their own. You do not need to report an additional Category 1 code with a Category 3 unless one is otherwise required to fully describe the services that are rendered. One of the unique aspects of Category 3 codes is how frequently they are updated. The AMA reviews and updates these codes twice each year. Updates are published on January 1st and July 1st. However, after publication, these new codes are not implemented immediately. Instead, they go into effect 6 months after their release. The AMA maintains the most current list of these codes and their implementation date on their official website, so it is important for coders to stay current and check for updates regularly. So in summary, your Category 3 codes will provide a mechanism for tracking the use and clinical outcomes of new procedures and technologies. Over time, if a Category 3 service becomes widely accepted and it meets specific criteria, then it may eventually be reassigned as a permanent Category 1 code. Now, as we wrap up our discussion on Category 3 codes, there's one very important instruction that's located directly within the guidelines for this section that I want to emphasize. In the middle of the first paragraph of the guidelines for your Category 3 codes, the CPT codebook specifically states that if a Category 3 code is available, this code must be reported instead of a Category 1 unlisted code. This sentence is extremely important to remember when selecting codes. If a Category 3 code exists for a particular service or procedure, you are required to report that Category 3 code rather than using an unlisted procedure code from Category 1. Unlisted codes should only be used when there is no specific code, including a Category 3 code, that exists to describe the service that is provided. I highly recommend that you take a moment to locate this sentence in your CPT book and highlight it for future reference. Having this reminder easily accessible can help prevent coding errors and ensure that you are following correct coding protocol at any time that you encounter a procedure that falls under emerging or experimental services. Let's return to the beginning of the CPT codebook and review its overall structure. The CPT codebook is organized by sections, and these sections contain the Category 1 codes. You can clearly see this organization simply by flipping through the book and looking at the different sections as they appear in order. Each section includes various services and surgical procedures, which are further divided into subsections. As you navigate through each section, you'll notice that every section begins with its own set of section guidelines and a table of contents that applies specifically to that portion of the codebook. These guidelines are essential because they give you the instructions on how to properly apply the codes within that section. In some sections, you'll also find a dedicated notes section located at the end. These notes will serve as helpful references, providing additional clarification or reminders that assist with accurate and efficient code selection. After you move through all of the CPT sections containing your Category 1 codes, you'll then find your Category 2 and Category 3 codes. These are placed towards the back of the book. And following those codes, you will find the appendices, which contain valuable supplementary information. And then finally, the alphabetic index, which allows you to search for codes based on main terms and procedures. Understanding this structure will help you navigate the CPT codebook more quickly and efficiently as you locate and assign codes. CPT guidelines are an essential part of using the codebook accurately. You'll find these guidelines referenced in the introduction of each section and subsection throughout the CPT codebook. The important thing to remember is that these guidelines apply specifically to the section or subsection where they appear. They are not intended to apply to other sections of the CPT codebook unless otherwise stated. Each set of guidelines provides you with the information that is necessary to correctly interpret and assign codes for the services that are described in that particular section. They help define what is included in a service, when additional codes may be required, and any special considerations that you need to take into account before selecting a code. The CPT guidelines exist to ensure that coding is consistent, accurate, and reflects the services that are provided as documented. As you become more familiar with the CPT codebook, always make it a habit to read and review these guidelines before assigning codes. They serve as an important resource for correct code selection, and they can often prevent costly coding errors. Throughout the CPT codebook, an established set of conventions and symbols is used to help guide coders in the correct interpretation and selection of codes. These conventions and symbols will serve as a universal language within the book, providing important coding information in a format that is both clear and easily recognizable. The CPT conventions include the use of indentations, which visually organize the code hierarchy and help distinguish between main procedures and related services or variations. In addition to indentation, the CPT codebook incorporates a variety of code symbols, sometimes referred to as an iconology. These symbols quickly alert you to important details such as new codes, revised codes, or codes that are exempt from certain modifiers. Another important convention used throughout the book is the parenthetical instruction. These parentheticals are placed directly beneath codes and offer specific guidance on code usage, related procedures, or additional codes that may be required. They serve as helpful reminders and cross-references to ensure accurate code selection. By understanding and consistently applying these conventions and symbols, coders can navigate the CPT codebook more effectively and make more informed coding decisions that align with official guidelines. Let's take a moment to apply what we've just discussed about our conventions and symbols by looking at an actual example within the codebook. Go ahead and locate CPT codes 11000 and 11001. As you can see, code 11001 is indented under 11000. This indentation means that part of 11001's description comes directly from its parent code, which in this case is 11000. In other words, you must read the full description for 11000 and then apply the additional wording provided under 11001 to fully understand the service that is being described. Next, you'll notice a plus sign next to 11001. This symbol indicates that 11001 is an add-on code, and add-on codes are used to report procedures that are performed in addition to primary procedures, and they can never be reported alone. Directly below 11001, you'll also see a parenthetical instruction. This parenthetical provides additional guidance to help ensure proper reporting of the code. It may direct you to related codes, coding restrictions, or other important information to consider when assigning your code. This example demonstrates how important it is to pay attention to indentation, symbols, and parenthetical notes. Each of these elements works together to provide complete and accurate coding instructions, helping you avoid errors and select the correct code for the services that are performed. As we continue to look at the CPT code 11000, there's another important convention that you'll see in its description: the use of the semicolon. The semicolon plays a very specific role in how CPT code descriptions are written and interpreted. In CPT, the semicolon divides the description of a code into two distinct parts. The words that appear before the semicolon are referred to as the standalone code or the common portion of the procedure. And this portion describes the main service or the procedure that is being performed. The words that follow the semicolon are used to complete the description for the related indented codes that come immediately after the parent code. These indented descriptors are dependent on the standalone code that precedes the semicolon. In other words, you read an indented code, you read the standalone code first, followed by the additional wording that appears after the semicolon under the indented code. This format allows CPT to efficiently list multiple variations of a single procedure without having to repeat the full description for each code. Understanding how to read codes that use your semicolons and indentations is essential for correctly interpreting the complete procedure that is being described and selecting the most accurate code. Now, let's look at one more example that demonstrates the use of the indentation and the semicolon conventions. Go ahead and locate code 00160 in your CPT codebook. The description for 00160 reads anesthesia for procedures on nose and accessory sinuses, followed by a semicolon, and then the phrase not otherwise specified. As we discussed earlier, The portion of the description before the semicolon represents the common portion of the code descriptor or the standalone code. Now, look at the subsequent codes 00162 and 00164. You'll notice that both of these codes are indented under 00160. This indentation shows that these codes are dependent on the initial portion of 00160's description. To read these indented codes correctly, you would begin with the wording from the parent code, then add the unique wording from the indented code to complete the full procedure description. For example, the full description for code 00162 would be read as anesthesia for procedures on nose and accessory sinuses, radical surgery. You simply combine the common portion of 00160 with the additional descriptor listed under 00162. The same rule applies for 00164, where you again start with the parent description and then add the indented wording that follows. This structure allows CPT to avoid repeating long, similar phrases and keeps the codebook more concise while still providing the full description needed for each of the specific procedures. This indentation and semicolon convention is used consistently throughout the entire CPT codebook. Another commonly used icon throughout the CPT codebook is the plus sign. The plus sign is used to identify what's known as an add-on code. Some of the procedures listed in CPT can only be performed in conjunction with a primary procedure. When that's the case, the CPT assigns an add-on code to report the additional service. Add-on codes are never reported alone, and they must always be reported together with their associated primary code. The plus sign, placed directly before the code number, allows and alerts you that the code is an add-on code, and it requires a companion code to be properly reported. For example, if you locate 11201 in your CPT codebook, you'll see that the plus sign displayed in front of the code number, and this immediately tells you that 11201 is an add-on code. Following the description, there's also typically a parenthetical reminder stating that this code should be listed separately in addition to the code for the primary procedure. You can see that instruction provided here as well. Additionally, beneath many of your add-on codes, there is usually a parenthetical instruction that lists the specific primary procedure codes with which the add-on code may be reported. In this example, you'll see that the add-on code 11201 may be reported in conjunction with primary code 11200. Always pay close attention to these symbols and parenthetical instructions. They will ensure that you are using add-on codes correctly and that all related services are properly documented and reported together. There are a few additional symbols used throughout the CPT codebook that communicate changes to the code set from the year to year. These symbols help coders quickly identify new codes and revisions that have been made. First, let's talk about the red circle, also known as the red bullet. This symbol indicates that a new procedure code has been added to the CPT codebook. You can see an example of this by looking at CPT code 15778 in your codebook. The red circle next to this code tells you that it was newly added in the current edition. If you ever want to see a full summary of the additions, deletions, or revisions for the year, you can turn to Appendix B in your CPT codebook, where these changes are listed in detail. Next, we have the blue triangle symbol. The blue triangle tells you that a code has been revised. Specifically, it means that the wording of the procedure descriptor has changed from the previous year. You'll notice this symbol when you look at code 27280 in your CPT codebook. While the triangle lets you know that a revision has occurred, it does not show you exactly what was changed directly in the main section of the book. To see the specific changes, you'll again refer to Appendix B. For example, if you turn to 22600, you'll see the exact modifications that were made to the code descriptor. Appendix B provides a useful side-by-side comparison, allowing you to easily spot what was added, deleted, or modified. These symbols will serve as valuable tools to help coders stay current with yearly updates, ensuring accurate reporting and compliance with the most recent coding guidelines. Now, let's review 2 additional symbols used throughout the CPT codebook that help coders interpret changes and modifier usage. First, we have the facing triangle symbol. These triangles point towards each other and are used to indicate new or revised text that is not part of the procedure descriptor itself. You will often find facing triangles located within section guidelines or as part of your parenthetical instructions beneath a code. They signal that the wording in that portion of the guidelines or instructions has been recently updated. Let's look at an example. So if you turn to CPT code 34501, you will find a parenthetical instruction located beneath the code. In this parenthetical, you'll see the facing triangles surrounding the updated text. The new instruction reads, for injection of bone substitute material for bone marrow lesions, use 0707T. The facing triangles tell you that this parenthetical instruction was newly added or revised in the current edition of the codebook. Next, we have this symbol that looks like a circle with a line through it, which is the universal symbol for no. The CPT codebook uses this symbol to indicate that the code is exempt from the use of modifier 51. Modifier 51 is typically used to identify multiple procedures that are performed during the same encounter. However, when this symbol appears next to a code, it means that modifier 51 should not be appended, even when multiple procedures are performed. To see an example of this, take a moment to locate code 20974 in your CPT codebook. You'll see that this code has a circle with a line through it next to the code number. This tells you that if this procedure is performed with other services, you do not add a modifier 51. If you ever need a full list of codes that are modifier 51 exempt, you can find it in Appendix E of the CPT codebook. These symbols will serve as a quick visual cue that help you apply the codes correctly while ensuring compliance and coding guidelines. Now, let's review one final symbol that's used in the CPT codebook. Locate code 90668 in your codebook now. You'll notice that there is a lightning bolt symbol next to this code. The lightning bolt symbol identifies codes for vaccines that are pending FDA approval. In some cases, a vaccine product may be assigned a Category 1 CPT code even before the vaccine has received final approval from the FDA. This allows coders and providers to prepare for reporting the vaccine as soon as approval is granted. Once the FDA has approved the vaccine, a revision notation will be added to the AMA CPT Category 1 Vaccine Codes website to reflect the approval status. This way, you can always verify the current approval status of vaccines directly from the AMA's official resource. In addition to the website, you can also find a list of all codes pending FDA approval within Appendix K of your CPT codebook. Appendix K serves as a useful reference when you want to review which vaccine codes are still waiting final approval. By recognizing and understanding the lightning bolt symbol, you'll be able to correctly identify these pending vaccine codes and stay up to date as new vaccines move through the FDA approval process. For most of the CPT codebook, codes are going to be listed in strict numeric order. The one exception to this rule is the evaluation and management section, which appears at the very front of the book, even though its numeric range would normally place it later. However, as CPT evolves, sometimes new codes are created or code descriptions are modified, which can require certain codes to be placed out of their typical numeric sequence. When this occurs, the AMA uses a special symbol to help identify the codes that are out of sequence. This symbol is the pound sign. Anytime you see a pound sign next to a code, it tells you that this particular code has been resequenced and it no longer appears in its expected numeric location. Let's look at an example together. Turn to CPT code 46947 in your codebook. Where you would normally expect to find code 46947 listed in its numeric order, you instead see a reference that directs you to review the code range 46760 through 46910, which falls within the repair section of the digestive system. If you flip to the end of that section, you will find code 46947 located there. You'll see the pound sign next to the code. This pound sign indicates that the code is out of numerical sequence, but it is placed in this section to keep related procedures together for easier reference. If you ever need a complete list of all resequenced codes, you can find it in Appendix N of your CPT codebook. This appendix provides a helpful summary of all codes that have been moved out of their normal numeric sequence. Understanding the purpose of the pound sign will help you navigate the codebook more effectively and ensure that you don't overlook codes simply because they aren't located where you would expect them to be. In recent years, CPT has introduced additional symbols to address the growing field of telemedicine services. These symbols will help coders quickly identify codes that can be reported when services are provided remotely. The first symbol is the star. This symbol will identify CPT codes that are eligible for synchronous telemedicine services. Synchronous telemedicine will refer to real-time, interactive communication between the provider and the patient, typically using both audio and video technology. When reporting these services, coders are instructed to use modifier 95 in addition to the procedure code. Modifier 95 indicates that the service was provided through synchronous telemedicine. The second symbol you may see is the audio icon. This symbol identifies CPT codes that can be reported when telemedicine services are furnished using audio-only communications. In other words, these services do not require a video component. When reporting audio telemedicine services, coders should append modifier 93 to the procedure code to indicate that the service was performed through audio-only technology. Both the star and the audio icon serve as important visual cues within your CPT codebook, helping you recognize which services can be billed when performed through telemedicine, and they will ensure that the correct modifiers are applied for proper reimbursement. To select the correct procedure code, there are a few basic rules that you should always follow to ensure accuracy. The first and most important step is to review the medical documentation thoroughly. Carefully read through the provider's notes, operative reports, and any additional documentation that is related to the encounter. Your goal at this stage is to fully understand the procedures or services that are actually performed so that you can select the codes that accurately reflect the care that is provided by the healthcare professional. Once you clearly understand the services that are documented, your next step is to reference the alphabetic index in your CPT codebook to locate a CPT numeric code or a code range. The index provides several entry points for you to help locate codes. You may search the index by the condition that's being treated, the name of the procedure or the service performed, the anatomic site involved, or by looking up synonyms, eponyms, or common abbreviations that are related to the service. After identifying a possible code or code range in the index, you must then turn to the numeric section of the CPT codebook to review the full code descriptions. Carefully read each code's descriptor and match it to the documented procedure or service that is provided by the healthcare professional. This step is critical to ensure that you are selecting the code that most accurately reflects what was done. Throughout this process, pay close attention to the CPT guidelines, conventions, and iconography that appear alongside the codes. These include your section guidelines, parenthetical notes, symbols such as your plus sign for add-on codes, and then any applicable modifiers that may need to be applied. Following these steps will help ensure that you report the most accurate and compliant CPT code for payers for proper reimbursement. Let's walk through a coding example together to put everything that we've discussed into practice. We're going to locate the correct CPT code for an excisional biopsy of an ovary. The first step is to turn into the CPT index, and in the index, you'll begin by looking under the main term, ovary. Once you find ovary, look for the subterm, biopsy. Under ovary biopsy, you are directed to two possible code options, 49321 and 58900. At this point, you need to carefully read the code descriptions to determine which code best matches the service that was performed. 49321 is used for laparoscopic surgery. However, in this scenario, we are looking specifically for an excisional biopsy, which leads us to code 58900. Now that you've identified 58900 as a potential code, you'll turn to the numeric section of your CPT code book to review the full code description. In the female genital system section, you'll find that code 58900 is used to report a unilateral or bilateral biopsy of the ovaries. This confirms that 58900 is the correct code for an excisional biopsy of the ovary. This example illustrates the step-by-step process that you'll use over and over again as a medical coder, starting with a careful review of documentation, using the index to locate possible codes, verifying the code in the numeric section, and then ensuring the code description matches the procedure performed. As you review the descriptions for CPT code 58900, you'll notice that it includes the phrase separate procedure within parentheses at the end of the code description. This is another important CPT convention used throughout the codebook. When you see this separate procedure classification at the end of a code description, it serves as a reminder to coders that this procedure is typically considered a component of a larger, more comprehensive procedure. As a general rule, a separate procedure should only be reported individually if it is performed alone, or if it is performed independently of other related services that are provided during the same encounter. Let's apply this rule to our current example. If the biopsy of the ovary is represented by 58900 and it is performed in conjunction with another procedure on the female genitalia, such as a wedge resection of the ovary, which is reported with 58920, then the biopsy would be considered part of the larger procedure. In that case, reporting both 58900 and 58920 would be considered unbundling because the biopsy would be considered inclusive to the wedge resection. If you were to submit both codes together, 58900 would likely be denied as it would be unbundled into 58920. It is important to know that many of these bundling rules are also reflected in the NCCI edits or the National Correct Coding Initiative edits. The NCCI edits are widely used by payers to enforce proper coding relationships and to prevent unbundling errors. Understanding how to correctly apply the separate procedure designation will help you avoid these types of coding mistakes and ensure proper reimbursement. As mentioned before, NCCI stands for National Correct Coding Initiative. This program was implemented by CMS, the Centers for Medicare and Medicaid Services, to promote correct coding methodologies and to help control the improper assignment of codes that could result in an inappropriate reimbursement. The purpose of NCCI is to prevent coding combinations that would result in duplicate or incorrect payments. This includes identifying situations where two codes should not be billed together, where one code includes the work of another, or where unbundling might otherwise occur. Essentially, NCCI edits help ensure that providers are coding according to correct coding conventions and clinical logic. Medicare publishes many helpful resources relating to NCCI on the CMS website. These resources include coding policies that cover bundling and unbundling, guidance on the reporting of separate procedures, and additional CPT coding guidelines. Coders working with Medicare claims should always consult these edits to ensure compliance. Commercial payers often follow the NCCI edits as well, though they may also create their own bundling policies and then add additional proprietary edits on top of the NCCI guidelines. As a result, it is important to verify your payer-specific rules when coding for commercial carriers, as their policies may not match Medicare exactly. The NCCI procedure-to-procedure coding policies are based on a detailed analysis of standard medical and surgical practices. They also take into consideration CPT coding conventions, guidelines that are developed by national medical specialty societies, local and national coverage determinations, as well as a comprehensive review of coding practices. By following NCCI guidelines, coders help ensure that claims are coded accurately, appropriately, and in full compliance with both CMS and payer-specific policies. The correct coding file format is used with NCCI, and it includes something called a correct coding modifier or CCM indicator. This indicator helps determine whether a modifier can be used to bypass an NCCI edit for a particular code pair. The CCM indicator will display one of three possible values: 0, 1, or 9. If the indicator shows a 0, it means that a modifier is not allowed to bypass the edit. No circumstances exist in which the two codes can be reported together for that particular situation. If the indicator is 1, it means that a modifier is allowed, and if it is used correctly, it will allow the edit to be bypassed. If the indicator is a 9, this means that the use of modifiers is not specified. The 9 is typically used for code pairs that were deleted on the same date that they became effective, and its primary purpose is to ensure that no blank fields appear within the database. When a modifier is appropriate to bypass an edit, the modifier is applied to the column 2 code in the column pair. This allows you to override the edit, but only when documentation supports the use of the modifier. In addition to the CCM indicator, the NCCI edit tables also include a column labeled PTP Edit Rationale. This column provides the reason for the edit, which can be very helpful when you are trying to determine whether the codes may be reported together under certain circumstances. One rationale that you may see is that one service is inherently included in the other, meaning both codes should not be billed together, unless there is a distinct separate service that is performed that allows a modifier to be reported. Another rationale involves mutually exclusive edits, which means that the two procedures are clinically unlikely to be performed together on the same patient during the same encounter. For example, you may see this applied to two different lab tests that would provide the same diagnostic result. The PTP edit rationale may also reference your CPT guidelines or CMS manual instructions to justify why a certain code combination is bundled. Reviewing this rationale can help coders make more informed decisions about whether a modifier is appropriate and when it is acceptable to override an edit. Once you have determined which code pairs can be reported together, the next step is to accurately sequence the codes on the claim form. Sequencing is important because it determines how the claim will be processed and reimbursed. The sequencing of your CPT codes is based on the resource-based relative value scale, commonly known as the RBRVS. This system assigns a relative value to each CPT code based on several key components. The first component is the physician work value, which reflects the time, skill, effort, and decision-making required to perform the service. The second component is the practice expense, which accounts for the overhead costs that are involved in providing the service, such as staff, equipment, and supplies. The third component is based on professional liability insurance, which considers the relative risk and malpractice cost that is associated with performing the service. All of these components are combined to calculate the relative value units, or the RVUs, for each procedure code. The relative value codes for each CPT code can be found on the CMS website, which publishes the full physician fee schedule. When sequencing multiple procedures, the code with the highest total RVU is listed first. Subsequent codes are listed in descending order based on their RVU values. This ensures that payers correctly apply any multiple procedure payment reductions or bundling rules according to the correct code hierarchy. By following proper sequencing based on your RVUs, coders help ensure accurate claims processing and appropriate reimbursement for the services provided. Throughout the CPT codebook, you'll often see references to the CPT assistant. Let's look back at CPT code 58900 in your CPT codebook as an example. Take a moment to locate it. You'll notice that beneath the code descriptor, there are references listed such as CPT changes in Insider's View 2000 and CPT Assistant November 9929. These references point you to additional official AMA resources that provide further clarification, guidance, or background on the coding and the use of that particular code. In this example, it means that information regarding 58900 can be found in CPT changes and Insider's View from the year 2000, and also in the November 1999 issue of the CPT Assistant on page 29. CPT Changes in Insider's View is an annual publication created by the AMA. It explains the rationale behind code changes made to the CPT codebook for that particular year. This resource is extremely helpful for understanding why a code was added, deleted, or revised. The CPT Assistant is another valuable AMA published resource that offers monthly articles answering real-world coding questions. It provides NCCI bundling information, E&M billing guidance, detailed use and interpretation, case studies demonstrating practical application of codes, anatomic illustrations, coding charts, information for appealing insurance denials, and guidance to validate code usage during audits. Because CPT Assistant is produced directly by the AMA, it is considered an official reference and is widely accepted by payers and auditors. And it is available by subscription only. By utilizing both CPT Assistant and CPT Changes, coders have access to authoritative resources that can help answer complex coding questions and support coding decisions during audits, appeals, and payer reviews. At the very back of the CPT codebook, after the Category 3 CPT codes, you'll find the appendices section. This section contains a variety of helpful references that support coding specificity and provide additional examples, explanations, and coding resources for the reader. Now, let's take a moment to locate Appendix A in your CPT codebook. Appendix A contains a comprehensive list of CPT modifiers organized into separate categories. The first section is the CPT Level 1 modifiers, which lists all the modifiers applicable to CPT codes. There are additional modifiers that are most commonly used to report additional details about services, such as increased procedural complexity, multiple procedures, or professional versus technical components. Following that, you'll find the anesthesia physical status modifiers. These modifiers are specific to anesthesia services, and they reflect the patient's physical condition at the time that anesthesia is administered. Next, there is a dedicated list of modifiers approved for the use in ASCs and hospital outpatient settings. These modifiers help communicate specific circumstances unique to outpatient hospital and surgical facility services. The final section of Appendix A contains a list of commonly used HCPCS Level 2 modifiers. These are national level modifiers typically used for durable medical equipment, supplies, and other non-physician services or products. Modifiers are used to provide additional information to payers about the service or procedure that was performed. They explain specific circumstances, alterations, or situations that affect how a service was provided without changing the fundamental definition of the procedure or the service itself. The use of modifiers is an important part of correct coding and is covered in greater detail in a separate lecture. The next several appendices in the CPT codebook were also mentioned earlier in this presentation. Let's take a moment to walk through each of them so that you're familiar with where to locate this important reference information. So first, let's take a look at Appendix B. Appendix B contains the actual changes and additions to the CPT codes from the previous year. This is where you can review what changes have been made to codes that were either modified, added, or deleted since the prior edition. If you want to see what has changed year to year, Appendix B is where you would look. Appendix C provides clinical examples for evaluation and management services across your different specialties. This appendix offers helpful examples to clarify the appropriate use and selection of E&M codes in the real world with clinical scenarios. Next, we look at Appendix D. This is a summary of CPT codes that are not reported as single or standalone codes. These codes listed in this appendix are identified throughout the CPT code book by the plus sign, which will indicate your add-on codes. These codes will always require a primary procedure in order to be reported. Now, we also mentioned Appendix E earlier. This contains a summary of CPT codes that are exempt from the use of Modifier 51. Remember, Modifier 51 is typically used for multiple procedures. However, the codes that are listed here in Appendix E are identified as not requiring the use of this modifier, even when multiple procedures are performed. Now let's look at Appendix F. Appendix F will contain a summary of CPT codes that are exempt from the modifier 63. Modifier 63 is used to report procedures on infants that weigh less than 4 kilograms. However, the codes listed in Appendix F generally involve congenital anomalies or procedures that already account for the increased complexity of working on very small or premature infants. As a result, modifier 63 is not needed for these codes. Throughout the CPT codebook, you'll also find parenthetical notes next to these codes reminding coders not to append modifier 63. These appendices serve as valuable reference tools that support accurate code assignment, proper modifier use, and a deeper understanding of how CPT codes are applied in clinical practice. Next is Appendix G. Previously, Appendix G contained a summary list of all CPT codes that include moderate conscious sedation. However, the guidelines for moderate conscious sedation were updated, and Appendix G has since been deleted from the CPT codebook. The book now refers coders directly to the new guidelines and codes for moderate sedation, which are 99151 through 99153 for services that are provided by the same physician, and 99155 through 99157 for services that are provided by a different physician. Next, turn to Appendix H. Appendix H previously contained an alphabetic index of performance measures by clinical condition or topic, which related to Category 2 codes. Since these performance measurement codes are constantly being updated, the AMA has removed Appendix H from the CPT codebook. This information is now maintained exclusively on the AMA's website to ensure the most up-to-date version is always available. And finally, Appendix I was deleted following the removal of the molecular pathology stacking codes. This appendix previously contained the genetic testing code modifiers that were reported in conjunction with those now deleted stacking codes. As molecular pathology coding was revised and new, more specific codes were created, the need for these modifiers and for Appendix I was eliminated entirely. Now, let's turn to Appendix J. Appendix J provides a detailed summary that assigns each sensory, motor, and mixed nerve to its corresponding nerve conduction study code. This resource helps enhance the accuracy of reporting for nerve conduction studies by matching the appropriate codes to the specific nerves that are being tested. In addition to the nerve listings, Appendix J also includes a helpful table that outlines the reasonable maximum number of studies that are typically performed for a physician to arrive at an accurate diagnosis. This table can serve as a valuable guidance to avoid over-reporting and under-reporting nerve conduction studies. Next, let's turn to Appendix K. Appendix K lists a product that are pending FDA approval. Some vaccine products have been assigned CPT Category 1 codes in anticipation of future approval, but have not yet been fully approved by the FDA. These pending vaccine codes are identified throughout the CPT codebook by the lightning bolt symbol. When you see this symbol next to a code, it indicates that the code is pending FDA clearance. For the most up-to-date information regarding vaccine approvals and any changes to these codes, you can visit the AMA CPT Category 1 vaccine code page. By reviewing Appendices J and K, you'll gain access to highly specialized coding guidance that supports accurate and compliant reporting in these unique coding situations. Next, let's turn to Appendix L. Appendix L will play an important role in coding for vascular procedures. It provides a visual and written guidance that illustrates the vascular families emerging from the aorta. This appendix is based on the assumption that the patient has normal vascular anatomy and that the vascular catheterization starts at one of the four major entry points: the aorta, vena cava, pulmonary artery, or the portal vein. The diagram in Appendix L uses brackets to identify the hierarchy of vessel branches, labeling them as first, second, third, and beyond third order branches. The first order branches are the largest vessels that emerge directly from the aorta. The second order branches emerge from those first order branches, and then the third order branches will branch off from the second order vessels. Beyond third order refers to any additional branching beyond the third level. If the starting point of the catheterization is somewhere other than the aorta, such as the vena cava or the pulmonary artery, the branching orders may change. This appendix is a valuable resource for correctly identifying the proper catheterization codes based on how far the catheter was advanced into the vascular system. Now, let's continue to Appendix M. Appendix M is a summary table that provides crosswalk information for deleted and renumbered CPT codes and their corresponding descriptors. This appendix is especially useful when you're researching code changes or reviewing citations and publications that refer to CPT codes from previous years. It allows you to quickly determine which code replaced the deleted or renumbered code. In addition, crosswalk citations are provided for CPT assistant references, making it easier to locate official AMA guidance for deleted code. This tool will help ensure that you are using the most up-to-date CPT codes while still being able to trace historical references when needed. Appendix N contains a listing of CPT codes that have been resequenced. So we've discussed the resequencing codes earlier. Occasionally, codes are modified or new codes that are introduced that, for organizational or content reasons, do not fit into the normal numeric sequence of the code book. Instead of resequencing the entire code set, these codes are assigned a number that falls outside of their expected position. Appendix N allows you to easily locate and identify these resequenced codes to ensure that you are using the most accurate code placement. Appendix O includes a listing of administrative codes for multi-analyte assays with algorithmic analyses, also known as MAAA procedures. These types of tests typically involve multiple lab tests combined with complex mathematical algorithms to produce a clinical risk score or diagnostic interpretation. Many of these codes are unique to specific clinical labs or test manufacturers, and Appendix O provides a central reference for these specialized administrative codes. Finally, turn to Appendix P. Appendix P provides a summary of CPT codes that may be used to report synchronous telemedicine services, which are real-time interactive services between a provider and a patient. These codes can be reported with modifier 95 to indicate that the service was provided via synchronous telecommunication technology. As telemedicine services continue to expand, Appendix P serves as a helpful guide for identifying which codes are eligible for telemedicine reporting. Now let's turn to Appendix Q. Appendix Q was created specifically in response to the numerous vaccine and administration codes released for severe acute respiratory syndrome, coronavirus 2, or SARS-CoV-2, which is responsible for COVID-19. As multiple vaccines have been developed, each with its own specific product code and administration code, Appendix Q provides a consolidated listing of the appropriate CPT codes for each COVID-19 vaccine product and its related administration. This appendix allows coders to quickly verify which product and administration code should be reported for each specific COVID-19 vaccine, minimizing confusion and supporting accurate coding during the public health reporting and reimbursement. Next, we have Appendix R. Appendix R introduces a taxonomy for digital medicine services. As digital health technology continues to expand, this appendix was developed to promote greater understanding and awareness of various digital medicine services that are now available to patients and providers. Appendix R includes definitions and classifications for a wide range of digital medicine services, such as remote physiologic monitoring, therapeutic monitoring, and other patient care approaches that are delivered via digital platforms. This taxonomy will help coders, payers, and providers appropriately identify and report services falling under the umbrella of digital medicine. Appendix S introduces the artificial intelligence taxonomy for medical services and procedures. As artificial intelligence continues to expand its role in healthcare, this taxonomy provides guidance for classifying various AI applications, such as expert systems, machine learning, and algorithm-based services, into one of three categories: assistive, augmentative, and autonomous. The classification is based on both the clinical service being performed and the amount of work done by the machine on behalf of the physician or other qualified healthcare professional. Assistive AI supports the provider's work without replacing clinical judgment. Augmentative AI may interpret data or provide decision support that enhances the provider's clinical assessment. Autonomous AI performs tasks independently that would otherwise require direct provider involvement. This taxonomy helps coders accurately assign CPT codes for services involving artificial intelligence and ensures appropriate reporting as this technology evolves. And lastly, if you turn to Appendix T. Appendix T contains a listing of CPT codes that may be used for synchronous, real-time, interactive, audio-only telemedicine services. These codes are identified when appended with modifier 93, which indicates that the service was performed using audio-only communication technology. You will also see that the audio symbol or icon in front of these codes throughout your CPT codebook. As telemedicine continues to grow, this appendix ensures that coders can quickly identify which services are eligible for audio-only reporting. You've now completed your review of the CPT codebook. We've walked through the structure of CPT, including Category 1, 2, and 3 codes, section guidelines, subsections, conventions, symbols, and how to properly navigate the book. We've explored various appendices, A through T, which serve as valuable resources for accurate coding. They will clarify special circumstances and help you stay current as CPT evolves. Remember, the key to successful coding is attention to detail. Always review your documentation carefully, reference your guidelines, and make full use of the codes and appendices within your CPT book. The more comfortable you become with navigating your CPT manual, the more accurate and efficient you'll be as a coder. Thank you for joining me for this CPT overview. Continue to study, practice, and more importantly, stay curious and keep learning. Your knowledge is the foundation for proper reimbursement, compliance, and quality patient care.